Hello and welcome to this informative video on the mental disorder that is attention deficit hyperactivity disorder. Better known as ADHD, the American Psychiatric Association described this disorder as a neuropsychiatric disruptive behavioral disorder. So what is this disorder? How does it show itself? Well, individuals can exhibit such symptoms as hyperactivity, inattention, and impulsivity. This disorder can affect all areas of one's life, whether it be occupational, educational, or social. For example, a child having difficulty focusing in the classroom, the ability to be able to meet a deadline for an important work project, conflict with one's family, problems with peers, whether it be in the workplace, the school playground, no area of the patient's life remains untouched by this disorder. In this video, we're going to talk about the diagnosis, etiology, epidemiology, treatment, and long-term prognosis of ADHD. This is done with the goal of cultivating a greater understanding of this mental disorder among other healthcare professionals.
Let's talk about the etiology and epidemiology of ADHD. The etiology of ADHD is understood to be caused by a network of biological, psychological, and social factors with strong genetic tendencies. Symptoms are classified as a trait-like scale rather than a differing category. Evidence is increasing regarding environment influencing the genetics of ADHD. Although the disorder is still known to be caused by heritable factors, the environmental factors may empower or weaken the ADHD symptoms. Exposure to tobacco or other chemicals can have influence on the ADHD diagnosis. Children and teenagers with ADHD have been proven to use health and mental health services more than others, also engaging in more health-endangering behaviours such as smoking and alcohol and substance abuse. It is suggested that there are three core issues found in people with ADHD. These are important functions including working memory, visual spatial orienting, and activation in the energetic state. Let's look at some of the diagnostic criteria for ADHD. The American Psychiatric Association Diagnostic and Statistic Manual is a comprehensive guideline when assessing and diagnosing ADHD. People with ADHD exhibit a persistent pattern of inattention and/or hyperactivity, including impulsivity that interferes with their development and daily functioning. When it comes to the criteria for inattention, 6 or more symptoms of inattention is required for children up to age of 16 years. Some examples of this criteria include often does not seem to listen when spoken to directly. The child often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. Or often has trouble holding attention on tasks or play activities. Next, let's have a look at some of the criteria for hyperactivity and impulsivity. 6 or more symptoms are also required for hyperactivity and impulsivity. This can include often having trouble waiting for their turn, often unable to play or take part in leisurely activities quietly, often talks excessively, often leaves seat in situations when remaining seated is expected. In addition to those symptoms, the following conditions must be met. There is clear evidence that the symptoms interfere with or reduce the quality of school, social, or work functioning. Several symptoms are present in 2 or more settings, such as home, school, or work. Several inattentive or hyperactive impulsive symptoms were present before the age of 12 years. The symptoms are not better explained by any mental disorder, such as mood disorder, anxiety disorder, dissociative disorder, or personality disorder. Individuals that experience ADHD don't simply outgrow the disorder. It is a mental disorder with no cure that individuals suffer for life. ADHD is a condition that requires a lifetime of management and treatment. Each specific behavioral or mental deficiency needs to be identified and a tailored treatment program determined to deliver an optimal performance for patients. There are several pharmaceutical and non-pharmaceutical treatment methods. Let's look at some of the pharmaceutical treatment options. There are several methylphenidate-based options, which include Ritalin, Concerta, Metadate, and Daytrana. There is also Adderall and Dexedrine, which also have longer release options. Now let's have a look at some of the non-pharmaceutical treatments. We have traditional psychotherapy, one-on-one counselling services, and targeted special education programs. Classroom behavioural, training teachers to improve classroom layout and content delivery to better suit their students. We also have cognitive training, shown to benefit medicated adults suffering from ADHD symptoms, which can also include social interaction and organizational training to improve patient outcomes. So in conclusion, ADHD is a neuropsychiatric disorder that has significant educational, occupational, and social ramifications. These extend throughout the life of the diagnosed patient, with no cure currently available. While the suspected causes of ADHD range from genetic to biological and environmental sources, what is known is that poor structure, substance abuse, lack of exercise, and lack of treatment greatly exacerbate the symptoms. Though modern treatment lacks specificity, there is a broad range of both pharmaceutical and alternative treatments available, ranging from stimulant and non-stimulant medications to counselling, parental and educator training, and most importantly, greater understanding of the disorder. It is important that any individual suspected of affliction be appropriately diagnosed through the set criteria listed above by a qualified medical professional and be given appropriate treatment, including education surrounding the condition, to greatly improve future quality of life. Thank you for your time and listening to this informative video about ADHD.